Okay, everyone should be able to see my presentation, hopefully. Great. Thank you all for joining us this afternoon. We know you have some great options for these sessions, so appreciate you spending some time with us. I'm here to discuss really a presentation based off of a very lengthy report that we just published at the Alaska Native Epidemiology Center. It's the Alaska Native Mortality Report covering years 1990 through 2018. It's a rather lengthy document. It's about 350 pages of tables and charts and graphs that's available on our website. So this is kind of just an introduction to that report, kind of skipping along the surface, touching on a few key topics, but there's a lot more to go into. So hopefully this will just be sort of a something that gets you motivated to dig deeper. Since we're at a research conference, a quick note on the methods. We use state of Alaska death certificates to determine the date of death, the year of death, really, the age of the decedent, the race. Again, we're primarily focused on Alaska Native people, but we do have some comparisons to U.S. all races to provide context for some of the information. And we've found that a lot of people use these reports for grant writing, and apparently grant reviewers like to see some element of disparity in health indicators. So we have some of those comparisons. And then the cause of death. So we categorize the deaths into causes to sort of provide some structure and kind of understanding of, these statistics. The rates that you'll see in this presentation and in the report are age adjusted to a standard population. And that really just gives a way to provide sort of some more accurate comparisons between two groups that might have differing risk profiles. So you can think of maybe two towns that, one town is populated by all high schoolers and the other one is populated by all people, over the age of 75. They're going to have very different risk profiles in sort of the types of deaths that might be occurring or the number of deaths that might be occurring. So when you sort of age adjust these rates to a standard, you provide a little bit more ability to make some meaningful comparisons. So how are deaths classified? There's been a lot of coverage in the past or public debate, obviously, in the past year about what deaths count towards what. There's a number of political debates about sort of how to classify death, whether death is due to a specific cause. And so when you look at a death certificate, there's basically this thing called an underlying cause, and then there's a following list of contributing causes. And the way to think about that underlying cause is sort of the disease or the, in the case of unintentional injuries, the event that precipitated the death. If you, for example, are have heart disease or cancer, but get in a car accident, it's that traumatic event that's going to cause sort of lead to sort of the immediate death. So in a lot of cases, contributing causes are either related or unrelated to the death. It's very rare to have deaths with no contributing causes. I think less than 1% of Alaska death certificates have that. Last time I checked. And so when we think about how to classify death, most people think about this underlying cause. So it's kind of the immediate event, the immediate disease that leads to the death. These deaths are coded using International Classification of Disease version 10. Sort of grouping, and then the way we group these various codes into what we would call causes would be by the CDC, National Center for Health Statistics, has some coding guidance and documentation. So real quick, we're just going to breeze through a couple of slides on statistics. This is the top 5 leading causes of death for the time period 2014 to 2018 among Alaska Native people. They're listed in order of count. So if you have your eagle eyes on, you'll notice that sometimes the age-adjusted rates can sort of, because of the age group in which deaths occur and how those are weighted when doing the age adjustment, you can get some things where, for example, heart disease has fewer count of deaths, but might have a higher age-adjusted rate among Alaska Native people. So these are the top 5 causes for the most recent time period: cancer, heart disease, unintentional injury, suicide, and COPD. They're all, the rates for among Alaska Native people are all significantly higher than the corresponding rates among U.S. all races. The biggest disparities are unintentional injury and suicide. And that's kind of the summary of these results. Years of potential life lost. So this is a really sort of important sort of health indicator or measure of health, I think. The way this statistic is calculated is basically you think about, you sort of set a target age for these calculations at 75, and then every if a death occurs at 50, at age 50, that person has lost of 25 years of potential life. So it's a really kind of meaningful way, I think, to think about premature death for among populations. So the leading causes among Alaska Native people for the 2014 to 2018 time period: unintentional injury, suicide, cancer, heart disease, chronic liver disease, homicide are sort of account for the most total years of potential life lost. And you can see the means there in the far column as well. And a way of visualizing those means I have on the next slide here. So perinatal conditions most frequently result in death at a very young age. So those average out to having a full 75 years of potential life lost. Congenital malformations, again, typically occur in younger individuals, and then you start to see things that are, occurring in adolescence to middle age, and so on. So here's a regional sort of profile of the age-adjusted all-cause mortality rate. One of the interesting things of looking at the most recent time period in this report is that we typically, especially in the 1980s, early part of the 1990s, you saw this big ring around in rural Alaska where due to frequently due to unintentional injuries, there were higher rates of all-cause mortality than in the other population, and you're seeing that kind of that trend reverse a little bit. There's still some pretty high rates in rural Alaska, but the second highest all-cause mortality rate for the most recent time period was actually in the Anchorage-Matsu region. And sort of a good way to think about that or conceptualize that is that, we're starting to see sort of a shift in towards more chronic disease, kind of lifetime issues that are contributing to mortality, and less of these sort of acute events. So that's sort of an interesting thing to point out. We have a number of tables that deal with life expectancy in this report. You can see just a quick trend here, the gap of life expectancy between Alaska Native people in Alaska and U.S. all races is gotten smaller, but there's still work to be done. And this, when people talk about life expectancy, this is often a very slow changing indicator. Again, life expectancy by region, you see that some of the regions with, as you might expect, higher than average all-cause mortality have sort of lower life expectancy. Quick word on successes. So for 10 of the leading causes of death, rates have significantly declined. Since 1980, heart disease, unintentional injury, that's been a major success. That's basically been cut in half in the last 30 years. Cerebrovascular disease, alcohol abuse, homicide, and influenza pneumonia. Really, that last one is due to some major gains in quality and ability to deliver care in some of these remote communities, ability to deliver medicines, and also having clean running water and some other things that we know affect public health and communicable diseases. So for more information, again, this hopefully this presentation is just really a plug for a big publication we put out. It's available on our website. There's a link there. I believe you get these slides with a clickable link in a copy of your information for this this conference. But if not, you can always Google ANTHC Epicenter, go to thctoday.org/epicenter. You can Google Alaska Epicenter. You might come up with a bit of earthquake stuff, but typically we're in those results as well. So that's what I have. Happy to take any questions. If you have any questions for the other presenters today. Yeah, thank you.
I'm checking the chat. I'm not seeing any, or the Q&A tab here. I'm not seeing any questions. Maybe people are typing, so we'll give them a couple minutes. So maybe I'll ask a question. So Ian, you mentioned in the successes that there was a decline in heart disease. What would you attribute that to?
I think it could probably be, as most. The way to start up most of those answers is a number of factors, but I know that there's been a big investment in delivering care to people and screening for some of these chronic health things in the Alaska tribal health system. And so, with some of these chronic disease causes of death, really screening and prevention and intervention, reaching people that, aren't typically, may not be on the road system, may not have, be dealing with those normal annual doctor interactions, and encouraging screening, encouraging preventive care, following up. I think that probably has a huge effect.
Sure. Okay, thanks. There is a A question here from Peter Hulk, and that is, are pandemic deaths likely to make any difference in mortality to statistics, or are they relatively too few to even register?
So, question, Peter. Nice to see you virtually. I've thought about the counts that we have in some of the preliminary reports, and if you look at sort of the average number of, we tend to group things into 5-year groupings to kind of smooth out a lot of that year-to-year variability. But we'll definitely see, if you were to look year on year, you would definitely see COVID deaths in the top 10. I think it would be probably about, there'll be somewhere in 6 to 7 in kind of a rank list among Alaska Native people for last year. That's kind of a preliminary, like I've done some rough on the back of my hand calculations, but yeah, it will definitely be a leading cause of death for 2020 among this population.